Hello everyone, this is Swati again. Today I'm back with part 2 of Abruptio placenta. Today I will be dealing with what are the clinical manifestations and what are the prognosis and management of patients suffering with Abruptio placenta. For those who had missed part 1, in which I have dealt with what is the definition, what are the types and etiology of Abruptio placenta, you can follow the link which I am sharing in the description box. The clinical features or symptoms of patients suffering with abruptio placenta basically depends upon three things. First, degree of separation of placenta or how much separation of placenta has occurred. Second one, the speed at which separation occurs. And the last one, amount of blood concealed inside. So these are the three things which determines what symptoms the patient will show. Coming to this slide, you can see a table in which all the symptoms are listed. Okay, so the symptoms of revealed on one side and mixed and concealed on the other side. So starting with the first, in revealed, the patient will have sign of abdominal discomfort and pain followed by vaginal bleeding. Okay, in mixed, the pain is acute, intense, followed by slight vaginal bleeding, and the pain becomes continuous. Okay, so what do we understand by this one? In revealed, abdominal pain happens first, followed by vaginal bleeding, whereas in mixed and concealed, the bleeding is acute. Okay, that means the intensity of pain is more in mixed and concealed. Why? Because the blood is accumulating and it is not finding any escape. As a result, the uterine muscles stretches, causing intense pain. Okay. Second thing, that is a characteristic of bleeding. In revealed type, the bleeding is continuous and it is dark in color. Okay, the bleeding can be slight or moderate. Whereas in mixed and concealed, the bleeding is continuous, dark in color, or blood stained, serous discharge. Okay, so here also both the places the bleeding is happening, whereas in the first one it is always dark blood, and in the mixed and concealed type it can be blood stained serous discharge as well. Okay. Now if you look at the general condition of the patient in revealed type of abruptio placenta, the general condition of patient is proportionate to the visible loss of blood. That means the patient, if she is having so much of blood loss, you can see that the patient's condition is similar to that of the amount of blood loss. Whereas in mixed and concealed, the blood loss which you see outside is lesser as compared to the shock present in the patient. Why? Because not all the blood is coming out. Only some portion of blood is coming out. The rest of the blood is insulated inside, as in concealed type. As a result, the bleeding which you see is lesser, but the condition of the patient is more critical. Coming to the next point, that is pallor. If you compare the pallor between revealed and mixed type, in revealed type, the pallor in the patient, it correlates with the visible blood loss. Okay, so if so much of blood loss is there, the pallor is more. If blood loss is less, the pallor is less in revealed. Whereas in mixed and concealed type, the pallor is usually more severe as compared to the visible blood loss. Why? Again, the same reason, because not all the blood is coming out. Only a portion of blood is seen outside. Therefore, the pallor will be more as compared to the visible blood loss. Features of preeclampsia. In revealed type, features of preeclampsia may be absent, whereas in mixed and concealed type, patient may also show features of preeclampsia or hypertensive disorders. Next point is uterine height. So if you check the uterine height or fundal height of a patient with revealed abruptio placenta, it will be proportionate to the period of gestation. That means if the patient is 32 weeks pregnant, the gestational height, uterine height will also be proportionate to 32 weeks. Whereas if you do abdominal palpation and find the uterine height in mixed and concealed type, you may find that the uterus is enlarged or feels more globular. Why? Because there is a lot of blood accumulation happened inside. Other than the baby, there is so much of blood. As a result, the uterus increases in height. So if the lady is 32 weeks pregnant, when you find out the fundal height, you may feel that it is 34 weeks or 36 weeks, depending upon how much blood is concealed inside the uterus. Okay, this is an important point to remember. Okay. Then uterine feel, when you do abdominal palpation in a woman with revealed type of abruptio placenta, you may feel that the fetal parts can be identified easily. Whereas if you palpate the mixed and concealed type of abruptio placenta, it's difficult to make out fetal parts because there is a lot of insulation due to blood accumulation. So you can't easily make out the fetal parts. Okay. FHS, if you go to monitor fetal heart sound, in revealed type it is usually present, and in concealed type it is usually absent. That is, most of the fetal death occurs in mixed and concealed type of abruptio placenta. Urine output is normal in revealed abruptio placenta and it's diminished in mixed and concealed. That is because of hypovolemic shock. If you see HP percentage in revealed type, it is proportionate to the amount of blood loss. Okay, and if you see in mixed type, it is lower or is not proportionate to that of the visible blood loss, which is again the same reason, because the blood loss which is seen outside is only a portion of the total amount of blood loss happening because of because of placental suppression. Okay, when you see the coagulation profile, it is usually not changed in revealed, whereas in mixed and concealed it changes variably. Okay, and if you do urine test for protein, in revealed type protein is usually absent in the urine, whereas in mixed and concealed type protein is usually present, which is another indication of hypertensive disorder in pregnancy. Coming to prognosis, the prognosis is divided into two: maternal prognosis and fetal prognosis. Starting with the maternal prognosis, in revealed type of abruptio placenta, maternal risk is proportionate to the visible loss of blood and maternal death is rare. Why? Because you can make out how much is the blood loss, and if you follow up with the proper treatment procedures and blood replacement therapy, the maternal death rate is rare. Whereas in concealed type, the prognosis is very uncertain. The following complication can arise either singly or in combination. So what complication can happen is there is hemorrhage, shock, blood coagulation disorder, oliguria and anuria, postpartum hemorrhage. So in concealed type, the prognosis is very uncertain. Most likely the death rates of fetus and mother is higher in concealed type because the following complications can arise at any time. Fetal prognosis in abruptio placenta is, in revealed type, the fetal death is as high as 25 to 30%, whereas in concealed, the fetal death rate ranges from 50 to 100%. That is on a very higher side. Okay. Other than that, the risk of reoccurrence in the subsequent pregnancy is 10 times with high perinatal mortality. Okay. So from this clip, we can make out that definitely abruptio placenta is a serious problem than the placenta previa, because both maternal and fetal death rate is very high in this. Now coming to management of abruptio placenta, the first thing is prevention. Okay, the prevention aims at elimination of known factor likely to produce placental suppression. Like if you remember the etiological causes, we have to keep good nutrition for the woman. We have to give iron supplements to the woman. The woman should not suffer from any kind of trauma, fall or direct hit to the abdomen. Okay, so all the things which are likely to cause abruptio placenta should be prevented. The second thing is correction of anemia during antenatal period, okay, so that the patient can withstand blood loss. So all the antenatal cases, the healthcare professional should try and restore the hemoglobin level to the highest, so that in case she suffer from any of this bleeding problem, she can withstand the blood loss. The last one is prompt detection and institution of the therapy to minimize grave complication which can arise because of placental suppression. So early identification of what is the problem with the patient, and hospitalization, basically tertiary care hospital, because it's the type of complication which requires multi-speciality approach, so has to be given in order to reduce the mortality rate and the complications. Now, after the preventive management, next comes the actual management of the patient when the patient is having the episode of abruption. In revealed type, what should be done? At home, the patient should be treated as in placenta previa, and arrangement is made to shift the patient in acute hospital. So this point I have already dealt in my placenta previa class, and if you remember from that, the patient at home should be immediately put to bed. Okay, the movement of the patient should be restricted. Check for the amount of blood loss happening and immediately call the ambulance and shift the patient to tertiary care hospital. This is what you have to do at home. Okay. Now, once the patient reaches the hospital, two things has to be checked: if the patient is in labor or not. If the patient is in labor, you have to accelerate the process by low rupture of membrane and by starting an oxytocin drip. Okay, so these two things, low rupture of membrane, oxytocin drip, will accelerate the labor and the delivery will happen soon. Now, if the patient is not in labor, you have to check two things: whether the pregnancy is 37 weeks or less. If the pregnancy is 37 weeks, that means the baby is now matured enough. You should not wait any longer. You have to induce labor by either low rupture of membrane or by giving an oxytocin drip. Okay, but in case if the pregnancy is less than 37 weeks, again check for two things. If bleeding is moderate to severe, then you have to deliver the baby by low rupture of membrane or adding the oxytocin drip. That means if the bleeding is more, you should not wait, you have to conduct the delivery. But in second condition, if the bleeding is slight or has stopped, the patient can be put into conservative treatment. That means wait and watch. Keep the patient hospitalized, continuous fetal monitoring to check the condition of the baby, and also check if the hemorrhage restarts again. Okay, so that is what the management is in revealed type. Now coming to management of mixed and concealed type. So these two varieties only have definitive management. Okay, there is no conservative management because, as we have discussed earlier, the death rate of both baby and the mother is very high in revealed and concealed type. So there is no wait and watch policy in mixed and concealed variety. Okay. If the patient is diagnosed with mixed and concealed abruptio placenta, there is only definitive management, that is terminate the pregnancy irrespective of the gestational age. Okay, what has to be done? First is blood sample is taken for grouping and cross match to make the blood available for if in case the lady needs a blood transfusion. Second thing is correct the hypovolemia to stabilize the patient. Okay, correct the hypovolemia. Next is do artificial rupture of membrane and conduct vaginal delivery followed by low rupture of membrane with or without oxytocin. Okay. Cesarean section is done in rare cases. There is no definitive indication for cesarean section unless it is an obstetrical requirement. Okay. In abruptio placenta, cesarean section is not an indication because placenta situation or location of placenta is normal. It is in the upper uterine segment. So for management of abruption, cesarean is not needed. Okay. It can be done only if there is some other obstetrical reason behind it. This is all about the management of mixed and concealed. So that completes our abruptio placenta. Thank you so much for being with me. In my next video, please wait for the questionnaires. I'll be dealing with essay and viva questions, that is both long and short essays and viva questions. And I'll be telling some tricks of how to score perfect marks in antepartum hemorrhage. I'll be sharing the link of the same in the description box. If you have any doubt, please write the same in the comment section. Please like and subscribe my channel. And if you want me to take any other topic in health and medical care, please write the same in the comment section. Thank you so much. Bye bye.